Good afternoon, Chairwoman Downey and members of the Assembly Human Services Committee. I am Donna Icovino. I proposed the convening of the Department of Human Services Dual Diagnosis Task Force, and I had the honor of serving as co-chair. Currently, I counsel special needs families through the Rutgers University Behavioral Health Care Mom-to-Mom Helpline, and I also oversee several support groups for, again, families of children and adults with special needs. I appreciate the opportunity to provide testimony before your committee. My 33-year-old son, Michael, is affected with autism and bipolar disorder. Over the past 15 years, I have advocated on behalf of developmentally disabled children and adults who engage in life-threatening, challenging behaviors such as self-injury, aggression, pica, property destruction, and elopement. When these behaviors are intense and frequent, they can significantly impair a person's functioning and place their lives and the lives around them at great risk. When an individual is in crisis, families and direct support staff have little choice but to enlist the help of local police, EMS, and ambulance transport to local hospital emergency rooms. Long waits and extended stays in the ER are common, as well as rejection from crisis screening centers and inpatient units. Individuals are inappropriately placed in state psychiatric hospitals and developmental centers. Typically, they are discharged to their home or community residences without a crucial therapeutic service plan in place. Unwarranted arrests and incarcerations occur. Further damage is incurred because frequently treatment providers do not understand the complex medical and neurological issues faced by these individuals, resulting in medication management issues, escalation of crises, and eviction from group homes, etc. Not surprisingly, the ER and hospitalization recidivism rates are very high, which only adds to the already severe trauma experienced by the individual and their families. Today, I am very pleased to present a plan that would begin to address these ever-widening service gaps by building an effective, cost-saving, and sustainable service delivery system. I have provided your committee with a 3-page overview outlining this interdisciplinary system approach to assessment and treatment, including the creation of a longer-term inpatient unit. The unit would provide intensive behavioral treatment for adults with severe and highly treatment-resistant behavioral disorders and would be modeled after the world-renowned neurobehavioral unit at the Kennedy Krieger Institute in Baltimore, Maryland. This comprehensive treatment model incorporates best practices, restructuring and improved coordination of existing services and resources, including invaluable but underutilized clinical expertise available throughout the state. New Jersey has spent well over a decade studying the unmet needs and significant obstacles encountered by developmentally disabled individuals in crisis who are in desperate need of appropriate behavioral and mental health treatment. It is now time to begin building effective service capacity, which will require quality-driven and methodical strategic planning. Governor Murphy's proposed funding for fiscal year 20 offers genuine hope to adults with comorbid severe behavior disorder and their families. Investing in accredited best practice treatment options will save lives and improve overall quality of life, giving individuals the opportunity to actively participate as valued contributors to our society. Moreover, it will strengthen the community-based service system while decreasing costly, ineffective care. It is said that a basic function of state government is to properly support the most vulnerable among us. Because this group of individuals have been terribly neglected in the past, taking immediate action has become an absolute moral imperative. I believe that with your committee's support and solution-focused leadership, we are poised to create effective change as we work together to better the lives of cherished loved ones whose families will accept nothing less. Thank you.
Thank you, Donna.